Hello, welcome to our Doc to Us podcast, Health Tips Weekly. Episode 22, Know Your Medications, Steroid. Have you ever heard of steroids? Chances are you have, perhaps from news regarding how a sports player uses steroids to boost his or her own performance. This is also known as doping, or maybe you are taking steroids for a medical condition. If you keep abreast of the development of COVID-19 treatment since last year, you may also know that some doctors use steroids to treat severe COVID-19 cases. To the general public, steroids sound like a blanket term for a class of drugs that is powerful, addictive, but may have significant side effects. While this knowledge are not wrong, there are more steroid medications that you would expect. Not all steroids are the same. In general, steroids can be classified into two groups, cortical steroids and anabolic steroids. Here's a rule of thumb. Whenever a steroid is mentioned in the context of medical treatment, it usually means cortical steroids. Cortical steroids are a group of steroids that are very good at lowering the inflammation level in the body. It is commonly prescribed for various diseases such as rheumatoid arthritis, asthma, and inflammatory bowel disease. Dexamethasone, an example of corticosteroids, is what some doctors use to treat severe COVID-19 patients. Other examples of corticosteroids are prednisone, prednisolone, and methylprednisolone. Here's a fun fact. Do you know that our body makes steroids naturally? These natural steroids are important for many physiologic processes in our body, including stress response, immunity, nutrients metabolism, regulation of inflammation, and levels of salts and electrolytes. Corticosteroids are essentially man-made steroids that are used as medical treatments. As useful as corticosteroids are, they come with many side effects. Those side effects can take place in many organs. Side effects range from those that are not necessarily serious but are displeasing to patients. Example, Cushingoid appearance, to those that are life-threatening, for example, serious infections. First of all, long-term use of corticosteroids may lead to changes on skin and appearance such as skin tanning, purpura, which is also known as the purple or red discolored spot on skin, occurs when small blood vessels in the skin burst, causing blood to pool under the skin. Weight gain, Cushingoid appearance, also known as moon face or facial puffiness, acne, hirsutism, which is also known as excessive growth of dark and coarse facial hairs in women, redness on face, striae, which is also known as stretch marks. Long-term use of corticosteroids is also associated with higher risk of developing cataract and also increased intraocular pressure, which can lead to glaucoma. Scientists also found that if you use corticosteroids, especially those that you ingest for long-term, it can bring cardiovascular-related negative effects, such as water retention and high blood pressure, higher risk of heart attack, stroke, and heart failure, and also the possibly high level of cholesterol. Therefore, if you already have some cardiovascular diseases or risk factors, taking steroids long-term may not be a good idea. On the other hand, corticosteroids is also known as to cause gastric pain ulcer, which the risk can be further increased if steroid is taken with non-steroidal anti-inflammatory painkillers or NSAIDs. Long-term use of corticosteroids is also well known for its ability to increase risk of osteoporosis, which reduces bone strength and higher risk of bone fracture. Think we are done here? Not quite. Corticosteroids are also known to cause metabolic side effects, such as leading to higher blood sugar level, which can complicate the treatment of diabetes if steroids is taken concurrently for other accompanying medical conditions. Secondly, hypothalamic pituitary adrenal, or in short, HPA axis suppression. This is a condition that happens when steroid treatment is stopped abruptly. The body's own steroid hormones production stopped all of a sudden, thus affecting one's well-being. Symptoms include fatigue, weight loss, salt craving, and also stomach complaints. Last but not least, corticosteroids also can lower immunity, which leads to higher risk of infection. But it used in treating severe COVID-19 though. Well, it is complicated, but in simpler terms, in severe COVID-19, the patient's own immunity goes haywire and enters into full-fledged inflammation. Steroids are used to reduce the extreme inflammation caused by the virus infection, not to eliminate the infection itself. Next, its use in children and teenagers are also not encouraged, as it can cause growth problems in children and adolescents. That is why you should never take steroids without the advice from a healthcare professional. If a doctor prescribes you steroids, you should also strictly follow the doctor's or pharmacist's instructions on how to take them. The reason that they are aware of the side effects of steroid medication but still prescribe you with steroids is because your medical condition may call for it, and the benefits of starting a steroid therapy outweighs the potential side effects that you may experience. Talk to your healthcare professional on how to handle or prevent these side effects, and do not stop taking your steroid therapy without your healthcare professional's advice. Although corticosteroids do have many side effects, drug makers manage to make them into different dosage forms. What this means is that an asthma patient who requires steroid therapy no longer needs to take a steroid pill and instead only needs to take inhaler steroids, which are also known as inhaled corticosteroids. Such pharmaceutical innovation is amazing because by inhaling steroids, it stays largely in the lung and only an insignificant amount may enter the bloodstream. As a result, the overall body is exposed to less steroids, which results in fewer side effects. Of course, not every steroid therapy calls for inhaled corticosteroids. In some cases, taking steroid pills which have more side effects is the only option. Other steroid forms include injection, nasal sprays, which is used in treatment of allergies, and topical steroid creams used in treatment for eczema and psoriasis. The less exposed the other body organs are to steroids, the lesser the side effects. Now let's talk about another group of steroids called anabolic steroids, commonly known as androgens. Similar to corticosteroids, androgens occur naturally in humans' body too. Testosterone is one of them. However, unlike corticosteroids, androgens have limited medical use. It is used in treating hormonal problems in men or an hormone replacement therapy for transgender individuals. However, androgens are more famous for its performance-enhancing ability and its abuse in sports. Because anabolic steroids mimic the naturally occurring hormones in the body, recreational athletes such as weightlifters and bodybuilders who use them to improve overall strength and personal appearance. Occasionally, high-profile athletes will also report to misuse androgens to enhance their performance. This is known as anabolic steroids misuse. All androgens have some side effects when taken in high doses. Other side effects depend upon the structure of the androgen or the steroids to which it is converted. For starter, anabolic steroids or androgens are known to cause acne, male pattern baldness, liver damage, premature closure of the growth center of long bones in adolescents, which may result in stunted growth and disruption of puberty in children. Use of androgens are also associated with psychological issues like increased aggressiveness and sexual appetite, sometimes resulting in abnormal sexual and criminal behavior, often referred to as roid rage. Withdrawal from anabolic steroid use can be associated with depression and in some cases suicide. Some side effects are gender specific. For instance, if a man abuses anabolic steroids, he may experience breast tissue development, shrinking of testicles, impotence, reduction in sperm production. Whereas for females, side effects such as deepening of the voice, cessation of breast development, growth of hair on the face, stomach, and upper back, enlarged clitoris, abnormal menstrual cycles may occur. Deaths were reported with anabolic steroids misuse. This is no joke, guys. Are you a big fan of traditional herbal products and supplements, and often buy them from random sellers who are not healthcare professionals? Well, be careful. Just when you thought the herbal products are unbelievably effective, you might be putting your own health in danger. Many herbal and traditional products, which are not registered with the National Pharmaceutical Regulatory Agency (NPRA), can be adulterated with steroids to boost the effects it claimed to provide. We should be careful with those medicine or food with extravagant medical claims, as they may contain steroid components. This is commonly seen in medicines that used to miraculously stop knee pain after consumption of the product. Traditional medicines that are contaminated with steroids can be easily obtained in retail shops. This is why you should never buy healthcare products from non-healthcare professional individuals. And always check if the product is registered with NPRA, as evident by the presence of the Meditech hologram sticker. That's it for this week's episode. If you have any related questions to steroids, you can consult our professional doctors and healthcare professionals on Doc2Us. Doc2Us is a mobile application that allows you to talk to a doctor or any healthcare professional via text chat at any time and from anywhere. For better communication, you can even send our online doctor images or voice messages related to your medical inquiry. Download Doc2Us app on Apple App Store, Google Play Store, and Huawei App Gallery, or use our web chat at web.doc2us.com. Doc2Us is not for medical emergencies. In the event of severe medical conditions, please call 999. Till then, stay at home and take care. Disclaimer: as a service to our users and general public, Doc2Us provides health education contents. Please note the date of last publication on all podcast episodes. No content on this podcast, regardless of date, should ever be used as a substitute for direct medical advice from your doctor or other qualified clinician. Till then, see you next time.